I'm Dr. Kevin James with the Heart and Vascular Institute of Texas. I want to spend the next few minutes telling you about one of the most important tests available in the diagnosis of and battle against heart disease. The cardiac catheterization is a precise method that helps us to determine exactly what's wrong with a person's heart. Once we know the problem, we can then decide how to fix it. It's important that you not eat or drink anything 4 to 6 hours prior to undergoing the procedure. Upon your arrival in the catheterization lab at the hospital, you will be greeted by medical staff who will assist during the procedure. Since you'll be awake during the entire procedure, among the first things we do is give you a mild tranquilizer to help you relax. Next, a local anesthetic or a numbing medication will be given to you in the upper part of your leg. This will help relieve any pain in the vicinity of the puncture, just as Novocaine helps numb your mouth during a visit to the dentist. After the anesthetic has taken effect, a small puncture is made in the skin immediately over the large artery feeding the leg, and a thin needle is inserted into the artery itself. Through this needle, we will pass a very thin, flexible wire into the artery and advance it approximately 2 feet. A small, hollow plastic tube is threaded into the vessel over the wire, and then the wire is removed. Through this short plastic tube, we pass very flexible tubes up to the heart. Through these tubes, we inject dye into the arteries that feed your heart. This allows us to find out whether or not there are any blockages in the coronary arteries, how bad the blockages are, and exactly where they are located. More dye is injected through another special tube that is passed directly into your heart chamber. This allows us to see how strong the heart muscle is, whether or not there are any previous heart attacks, and whether or not there are any leaks in the valves of the heart. In most cases, the preliminary findings will be evaluated and the results discussed with you before you leave the area. If the results indicate a condition that will need further attention, your options will be explained to you. Then a decision regarding the next step in your care can be made. After the procedure, you are taken to a waiting area. Pressure is applied at the incision site to allow a seal to form over the hole where the tube was inserted. For the next 5 to 8 hours, you will need to lie in bed and try to keep the procedural leg still so that the blood vessel has time to strengthen and heal. If you experience any significant pain or discomfort, or are tempted to move around in bed, don't hesitate to tell the nurse. This is important even if the discomfort is associated with another health problem such as back pain or arthritis, since either of these can cause you to move about. There are medications readily available to make you more comfortable. Remember, there's nothing wrong with telling the nurse that you're in pain. It's much better we give you pain medicine than have you dislodge or weaken the healing vessel. Although cardiac catheterization is considered a safe and common procedure, there are some risks involved, as there are with any procedure of this kind. Fortunately, complications are extremely rare. Most obvious is the possibility of excessive bleeding. Anytime an artery or vein is punctured, this potential exists, but significant bleeding from a catheterization would be very unusual. A second risk factor is infection. Again, however, infection becomes a possibility anytime someone sustains a cut. But because every preventative measure is taken, developing an infection after this procedure is extremely rare. A third possible complication is the development of a large bruise at the site of the arterial puncture. This occurs in about 1 out of 100 patients, but can generally be avoided by lying still after the procedure. A fourth complication is the development of an allergic reaction to the dye used in the procedure. Although extremely rare, an allergic reaction cannot be predicted. However, the allergy can be treated in the catheterization lab if the problem were to occur. The last but most profound risks are those of stroke, heart attack, or death. These can occur if cholesterol deposits present in the blood vessels coming out of the heart become dislodged and travel to wherever blood flow takes it. If it travels down to the big toe, then it can cause problems there. But if a piece of cholesterol goes to the brain, a stroke can occur. And if it goes to one of the coronary arteries, that is, one of the arteries that supply blood to the heart, a heart attack is possible. The odds of any of these events occurring is statistically less than 1 in 1,000. Although these risks sound frightening, actual complications seldom occur. If you're experiencing chest pain and shortness of breath, it's far less risky to perform the procedure to find out what's wrong and fix it than to totally avoid the procedure. When you go home following your catheterization, there will be certain things to watch for to help avoid complications. If any of the symptoms I'm about to describe occur, you need to contact us immediately. It is normal to have a small bruise or bump at the site of the artery puncture, but if you notice a bump or knot that increases in size, it could be a cause for concern and reason to notify us. In the first 3 to 5 days after your catheterization procedure, if you develop fever, have any redness of skin, or experience any kind of clear or cloudy fluid oozing from the site of the artery puncture, this may be a sign of infection. Typically, infections go away once treated with antibiotics. If you are the one person in 100 who gets a large bruise from the procedure, you will most likely experience tenderness in the area, but shouldn't worry. However, if you develop pain in your leg below the area where the artery puncture was made, particularly in the muscles of the leg or foot, this could be from the rare complication of cholesterol blockage breaking loose. If this were to occur, the leg may turn purplish or maroon in color, and you would need to contact us immediately for evaluation. If you are in doubt about any symptom you experience once you are home, call us. Even if it seems insignificant to you, it may be important for us to know. Call and let us make that determination. If you have any further questions about your upcoming catheterization procedure, please give us a call.